mynews.studio.
In 2024, scientists managed to prevent 1 million malaria deaths using advanced bed nets and new vaccines. So, are we finally getting close to eliminating malaria for good?
Today is 2025-12-12. The latest malaria report from the World Health Organization highlights what looks like a turning point. There were 170 million malaria cases, but 1 million deaths were averted in 1 year. But maybe let's slow down. How do these new tools actually work?
The major advances came from two directions: vaccines and bed nets. The vaccines, RTS-SASO1 and R21 Matrix M, teach the immune system to recognize and attack the malaria parasite, mainly Plasmodium falciparum. That's the form responsible for most deaths, especially among young children. When these vaccines are given to kids, particularly along with other prevention steps, their risk of severe malaria drops a lot.
And the bed nets, these aren't just the old-fashioned ones, are they?
Right, they're not. The latest nets use a combination of chemicals, sometimes called synergists. These target mosquitoes that have developed resistance to earlier insecticides. That resistance has been a real issue, especially in parts of Africa. With these improved nets, there are fewer mosquito bites, so fewer infections.
Why not just rely on vaccines then? Is it really necessary to combine them with other methods?
Good point. Vaccines are strong tools, but they're not flawless. They don't provide lifelong immunity, and not everyone gets them. That's why bed nets, preventive medicines, and rapid testing are all important. Think of it as layers. Each method picks up where the others might miss.
If these tools are this effective, what's stopping malaria from being wiped out everywhere?
That's where things get tricky. The issue isn't just insecticide resistance. We're also seeing some resistance to the drugs used to treat malaria. On top of that, climate change is shifting where mosquitoes live. For example, Anopheles stephensi is showing up in new urban areas, which makes control tougher.
Are there countries that have managed to eliminate malaria despite all these obstacles?
Yes, there are. Cabo Verde, Sri Lanka, and Georgia have all done it. They relied on strong political commitment, careful tracking of malaria cases, and quick action during outbreaks. But even after elimination, there's always a risk the disease could return, especially if attention slips.
So keeping up funding and strong health systems even after cases fall, that's essential, right?
Absolutely. If funding drops or health services weaken, malaria can come back fast. Ongoing monitoring and rapid action are non-negotiable. Otherwise, years of progress can be lost in just one season.
Aside from statistics, have you heard from people directly involved? Maybe scientists, health workers, or families in malaria-free regions?
Yes. Health workers often mention the relief of seeing fewer children in danger. Scientists talk about the shared effort when a vaccine rollout saves lives. Families in malaria-free areas say they can finally sleep without worry, or send their kids to school with peace of mind.
So it's not just about the technology. It's about cooperation and staying committed, even after progress is made.
Exactly. Scientific advances are only one part. The social, political, and human elements are just as important. The main approach: keep innovating, involve everyone, and never assume the job is finished.
To sum up, next-generation vaccines and nets are changing the fight. But reaching a malaria-free world will always need careful attention and investment. Other countries have lessons to share, both from their wins and their setbacks.
Thank you for joining us as we looked at how 1 million deaths were prevented and what still lies ahead in the effort to defeat malaria.
Thanks for listening. This episode was brought to you by mynews.studio. Try it free today.